I'm Dr. Gaby Berger. I'm a general internal medicine physician at the University of Washington. Now consider myself a full-time primary care doctor, but also wear an education hat with a role in our University of Washington School of Medicine, where I co-direct a longitudinal teaching and coaching program for our students. When I think about how the treatment of obesity or the approach to treating obesity has evolved over the last few decades, I actually just really think about the last 5 years, to be honest. I would say over the last few decades, we had a very limited set of tools in our toolkit to treat obesity, which affects millions and millions of Americans. And those tools were things like bupropion plus naltrexone, there's phentermine, and there are some other medications that folks may be familiar with. But I would say those are just not our go-to medications anymore. And the rise of the GLP-1 agonists as a class of medications to treat obesity has fundamentally changed our approach to treating this really important disease. The most significant innovations in treating obesity today are the advent of the GLP-1 agonist medications and the related GLP-1 / GIP medications. So that's both semaglutide and tirzepatide. These medications have revolutionized our approach to obesity, and I use them regularly in my practice. And it's really, really, really remarkable how effective they are, safe for many patients. And I have had patients say to me, this has changed my life. When it comes to metabolic surgery, I think that it really can still play a large role in modern obesity treatment. Previously, they actually played a much larger role in the treatment of this condition because we didn't have effective medications. But I think there's still a big role here, particularly for folks who maybe cannot afford the medications, the GLP-1 agonists or GLP-1 / GIP medications. These remain extremely expensive and out of reach for many people. So there may be a role for surgery in those situations. And for people who are really not ready to sort of commit to a medication long term. At this point, we don't really know how to effectively wean the medications and maintain weight loss. So metabolic surgery certainly can play a role there for folks who would prefer to avoid long-term medication use. The biggest challenges in treating obesity are absolutely the cost of the medications that we want to prescribe. So GLP-1 agonists and the GLP-1 / GIP medications are truly the gold standard in treating obesity at this point, and yet they remain extraordinarily expensive and out of reach for many of our patients. And this is really an equity issue. So folks who may be on Medicaid in their state or have what we call a sort of underinsured, meaning they do have insurance, but their copays are extremely high and the drug formularies available to them are quite limited. These people are really at a disadvantage when it comes to treating obesity. We have the drugs to treat, and we know that they work. We know that they're safe for a vast majority of folks, certainly not everyone, but a lot of people, and yet we're really hampered by the cost of these medications. Some conversations that I've had with an expert, Dr. Fatima Cody Stanford, and she is an obesity expert at Harvard Medical School and talks a lot about the stigmatization of obesity, particularly for Black and brown folks in this country. When I think about what we could do differently to treat obesity, it's not just about the medications, but it's really about addressing our own biases as providers around this medical condition. For many, many, many years, obesity has been deeply stigmatized, and that's true for providers as well. And we need to confront our own bias and understanding of this disease process and make sure that we create spaces where patients feel welcomed and comfortable talking about this disease process, and help them engage in healthcare that really is tailored to their individual needs and that makes sense for their health. When I think about where the research is going and future treatments for obesity, I really look to my colleagues who are practicing obesity medicine on some of the cutting edge in drug development there. I know there are a number of drugs in the pipeline that target the dopamine feedback pathways in the brain to interrupt that sort of the cycle of eating and a little bit of that sort of food addiction that some folks describe, or maybe not food addiction, but the voices that the food voice that people describe as sort of driving their eating habits. And I know that there are drugs in the pipeline that we'll be seeing on the market, I'm sure, in the coming years. And I have no doubt that this is going to fundamentally change how we treat obesity in the future.